Alright, welcome back to the Move Better Project, Run Better Project. Today I'm going to go over some mobility work. And this is stuff that you can think about as recovery or maintenance or really part of the overall running practice that you have to have. One of the key principles that I outlined when I was talking about my theory of what makes good running good is that it builds resilience. Well, if you do the drills that I've shown you and you utilize those in your running practice to build up the postures that we've talked about and build up that springiness of the foot and lower leg, you're going to build the strength of not only your muscles but also your connective tissues over time. But that's just part of it, is the active part where you do the building. If you think about it as like the resistance work, the weightlifting of becoming a stronger and better runner. The other part is the recovery. And if you think about your body as a machine, you would not just drive your car for hundreds and thousands of miles without changing the oil and rotating the tires and things like that. Hopefully it would. And recovery work is a really important piece of your overall running practice. So running isn't just the part where you go out and you put the miles in. It's also what you do to build up the strength of your body and to improve the mobility of your body and to improve that overall resilience. That's one of the key parts that we talked about. Alright, so I've got some tools here. Some of these you might have at home, some of you might not, some of them you might not. And I just want to show you how to do some basic stuff that will improve the mobility and the resilience of especially the key parts that tend to break down. We get plantar fasciitis, really common running injury, so this bottom of the foot, all these tissues, muscles and connective tissues in the bottom of the foot. The lower leg, we get issues like Achilles tendinopathy, we get shin splints in the front, runners get, so we want to address some of that stuff, these sliding surfaces and soft tissue restrictions. We want to also deal with the quads and hip flexors, things that prevent us from getting hip extension in running and end up leading to overextension, hip and back issues, IT band issues down the road. So, first thing we're going to cover is this is a lacrosse ball. If you don't have one of these, it is an awesome mobility tool and it costs you about $1. So you can order one any number of places online. Pick one up at a sporting goods store, probably not right now, but in the future when those kind of places are open again. Or you can just, like I did, go to your high school alma mater's football field and find a bunch of them left over from lacrosse players who left them outside. So we're going to start with the bottom of the foot. And this is just a really basic practice that you can do every single day, especially anytime you feel like you have any stiffness on the bottom of the foot. So my face is going to go out of frame now, and we're going to show you how to work the bottom of your foot with a lacrosse ball. So I'm going to start with the ball just under that sole of my foot. And I want to start just rolling side to side. My heel's on the ground and I'm right behind the ball of my foot. My first kind of metatarsophalangeal joint is right here. And I want to go rolling side to side, right behind that. And I'm just trying to free up the insertion of the plantar fascia along those MTP joints and also the insertion of some of those muscles that create the tension that gives us a nice plantar arch. So I'm going to do that. Maybe 25, 30 strokes back and forth. You can keep going if you're doing this on your own. I'm going to move to the next thing, which is doing longitudinal strokes. So this for me is where you'll find things that work for you that are your key spots that are really ugly. For me, this is the big one. These, forward and backward kind of longitudinal strokes with the ball. So I'm going along the kind of the direction that the arch goes, and I just want to find any ugly sticky spots. For me, right there, where I kind of get that tarso-metatarsal joint right in there, I got a really ugly spot that I need to work on. So there's a muscle on the inside of the foot that's implicated in a lot of plantar and foot issues called abductor hallucis. That for me is really ugly, so I can work on that a little bit. But I'm just doing really slow back and forth strokes. And the last thing, I'm going to clean up the origin or the proximal kind of insertion of that plantar fascia right in front of the heel. And this is the site where a lot of people who have plantar fasciitis have their pain, is right in that front of the heel. So This can be a delicate area. You might need to go really, really gently at first, and then you can work on eventually deepening in. And the key with this and any other soft tissue work is I'm going slow. I'm just kind of taking my time working in there, finding where the bad spots are. I don't want to just like roll around like this. This doesn't do anything. Well, it probably does something, but it's not as effective as getting in. For me, I'm going to find a really ugly spot right there, and I'm just going to breathe into it. Doing that just helps that muscle under there to relax. I can tack and stretch. I can push down and elongate that muscle by lifting up my toes. I can do all kinds of stuff, but I just want to get into that plantar surface. So that's number one, working on that with the ball. If I want to do something else for the bottom of my foot, I can just manually come in here and just stretch out. I'm just pulling my toes apart. So a lot of us who have been wearing shoes, you can see I stubbed this pinky toe pretty ugly the other day, who wear shoes all the time. These toes get stuck together, especially a lot of women's shoes are really, really bad at that, or men's dress shoes that come to a point. And they lose the ability to spread out and be active on the ground. So I want to restore that, and I'm just going to come in and gently stretch my toes apart. Doesn't have to be, I don't have to hold it for that long. I can just kind of do what feels good, open that up a little bit. And I'm just going to go each toe like that. I can also do a little forward and backward. One toe goes forward, one toe goes backward. Just adjacent ones going opposite direction. So I can do that all the way down the line. This is something that I just kind of wanted to show you. If you do have toes that are really stuck together, together, and you're not able to get that spreading out after. These are called yoga toes. It's actually my wife's. She bought them, a really cool thing. But you can put this on, you know, kind of starting with, I think it's like 10 or 15 minutes at a time, and you build up. And just putting this in here and just hang out with that on it, you know, while you're doing anything. And you can see it's just spreading out my toes passively. So if you struggle with that kind of foot mobility, your toes are really clamped down, just spending some time with something like this on can help open that up. So that's a little more of a passive way to work on that. So using the ball, doing some actual, individual work on opening up the bottom of the foot, really important part, and preserving that sliding surface mobility. I don't want that to get stiff and stuck down. All right, so next, what we want to do is work on the calves and work on the shins with the foam roller. So a lot of people have a foam roller at home. Few people have as many as me. I think I have 5 or 6 in here. Maybe it's 4 or 5. But the key thing is knowing what to do with this to effectively change your tissues in the way you want, which is not to just roll around. This is what I see a ton of people do, is just like back and forth really fast, not really doing anything. And that's kind of easy to handle, that amount of pressure, but it's not really going to produce the change that you want, which is we want to loosen up these stiff tissues. I have a lot of different layers of muscle in the lower leg. I have my gastrocnemius, this kind of surface calf muscle. I have my soleus under there. Deep to that, I have 3 more muscles that move my big toe, that move my ankle, that move all the other toes. So freeing up all of those layers of tissue to slide over each other and dealing with any real stuck or adhesed points and any trigger points that are in those muscles as well is what we want to do. And to do that, you have to go slow. So here's what I do for rolling out my calves. So I'm going to pop one foot up on there. I'm going to pop the other foot on top. That is going to allow me to put pressure downward. If you can't handle that at first, just one leg is okay. But what I want to do is I'm going to start down near the ankle, just about, 2 inches or so above my calcaneus. You can see where my Achilles tendon inserts because I have this beautiful Haglund's deformity on my heel. Maybe you don't have such a nice looking bump on your heel, but I do. So I'm going to start right about there, just above the ankle bones. Pop the other foot on top. I'm going to start to the side, and I'm just going to really slowly push down, and I'm smashing across. And I want to come back, push down, smash across. Just really, really slow. I'm going to do that 3 or 4 times at each spot. And then I just want to move the foam roller up a couple inches. Then I'm going to push down. I'm going to smash across. Lose my breath. That's not me just showing you how to breathe. I have to take a deep breath once I get a little bit higher because my calves are really stiff right now. I've been spending too much time sitting, not enough time getting out there and moving in isolation, so I'm paying for it. And you know, when you do this really slow, you find where the ugly spots are. And if you have a really ugly spot somewhere in that, you know, somewhere during that journey of smashing across, like for me, it's on the outside of my calf, that kind of lateral line. As I get to that, I'm just going to stop, hang out on it. Big breath in, and I can actually contract that muscle, try to flex the muscle that the foam roller is on. Breathe out, relax. So that's a way to kind of use my brain and my breathing to help relax these really, really stiff spots. So that's, again, breathing in, contracting the muscle, and then relaxing it. So I'm going to do that all the way from the bottom all the way up top. A lot of people tend to find that right at the bottom of the gastroc is that big thick part of your calf. That's where we have some of the ugliest spots. So get in there and work on it. If you're a real masochist like me, you can take the lacrosse ball and directly go at the really ugly spots. Now that might be too much. It's definitely going to be too much for a lot of people, but that's something you can build up kind of to tolerance. So that's for me, like I have a really just hideous spot right in there, and I can push down, breathe in, contract, breathe out, relax. So that's a way to kind of clean up the grit on the posterior side of the calf. We can basically do the same thing on the front, but we don't have as much meat here on the front in that tibialis anterior muscle, which is kind of the shin splint muscle. So I can do this kind of with the blunt instrument, the foam roller, and I can just pop on here. I'm going to start proximal. I'll show you from the side so you can see kind of what I'm doing here. I'm going to push down, and once I get to, I'm going to really slow downward. I'm just going to get to an ugly spot, and then breathe in, breathe out. And breathe in, breathe out, point the toe. And that pointing the toe is stretching the tibialis anterior muscle, and by putting the pressure down with the foam roller, I'm sort of tacking an individual spot in that muscle, and then I'm stretching it by moving my ankle back and forth. So I can do this all the way up and down, and that will be really productive for a lot of people and show you kind of some ugly spots that you have in there. Again, if you can take it, you can take the lacrosse ball and kind of get in here, and I can just go right next to my tibia, this kind of sharp bone right there in the front, and I can come in here and try to find the ugly spots and actually just do what we did with the calf, which is smashing across, trying to, almost like I'm pulling that tibialis anterior muscle off of the tibia, just stripping it away. Because the shin splint injury, what that is really, you get, this muscle just gets so tightened down and beaten up that it pulls little pieces of bone off of the tibia itself by just that repetitive stress. So we can kind of deal with some of that tension getting in there with a lacrosse ball or with a foam roller. So that's kind of my below knee maintenance. We worked on the bottom of the foot. We worked on the toe mobility. We worked on the calves. We worked on the shins. And then I also want to work on my quads. So again, I'm going to turn to my foam roller. And we want to do kind of what we did with the calf and get in there and do some real smashing. So I'm going to start up near the top here, and I want to start kind of sideways, and I'm just going to push down using pretty much my entire body weight here, and I'm just going to smash across. So this is one of the two things I like to do with the foam roller on the quads, is this real slow smashing. Kind of, again, I've got 4 different quadricep muscles, plus I have an IT band. All that connective tissue is supposed to slide over each other nicely. Unfortunately, it tends not to. So doing this kind of work can help restore some of that sliding surface mobility and get that quad to move a little bit better. And one of these quads, the rectus femoris right in front, is also a hip flexor. So if that's really tied down, it's going to prevent you from getting into hip extension. Not only leg going behind you when you run, but as we've talked about with posture, the pelvic tilt, getting into a neutral position. If the front of my hip is really tight, I'm not going to be able to get into that pelvic tilt / hip extension. I'm going to be stuck. And then that's going to lead to my back getting overextended. And then we can get some back pain and other stuff that we don't want down the road. So that's one way to work the quad. The other way is just start at the top, work on that rectus femoris right down Main Street, right here in the front. And I'm going to push down, and I'm just going to very, very slowly go all the way top to bottom. And I want to just stay right on that rectus femoris. It's the big, bumpy, stiff muscle on most people. And if I want to get really crazy with it, I can push down, breathe in, contract, breathe out, stretch the muscle by bending my knee. So to do that entire thing, top to bottom, should take you about 2 minutes. That's how slow we want to be going. So we worked on the lower leg, worked on the feet, worked on the calves, worked on the shins, worked on the quads a little bit. And then the last thing I want to do is show you how to get into your hip flexors a little bit with some soft tissue work. I'll show you some stretching that I do in the warm-up cool-down video, which may have already come out by the time this one's up. But for the hip flexors, there's 2 things we can do. This is a slightly deflated volleyball. You can use any ball that's a little bit deflated. And this is a kettlebell. So if you have these 2 things at home, you're set. If not, you might want to try to improvise, or you might just want to get a kettlebell because they're awesome. So first I'm going to show you how to get at your psoas with the volleyball. So psoas is a hip flexor muscle. It's the tenderloin of human beings. It starts on the front of the spine. So it attaches to L2 to L4 and then kind of comes down, passes through the inguinal canal, connects to my femur here at the lesser trochanter, and that's a big hip flexor muscle. And when that's tight, that prevents us from getting into hip extension. So I'm going to take this ball here, and I want to aim for a spot. If I put one thumb on this bony prominence, anterior superior iliac spine right there, and I put one thumb on my belly button, I want to just go halfway. That's kind of the spot I'm aiming for, somewhere in that region. You'll feel it when you get it, because it's no joke. So I'll show you on the left. I'm going to come in here, start just right above my iliac crest there, get in there with the volleyball, and I have to just try to relax my stomach muscles. And I'm going to come in from the side, again using my breath to stay relaxed. And I'm just going to come medial, aiming for that spot halfway between the iliac crest and the belly button. You can hear my voice get a little tight because I found it. I found my psoas, and that is an ugly spot. Just like we did before, I'm using my breath. Contract and relax. I can also tack and stretch. I can push down onto the ball, and I can lift my knee to extend my hip. Or I can squeeze my butt to extend my hip, or I can do both. Oh. So those are ways to get at your psoas with a ball that you can probably find somewhere around your house. Any deflated ball will work. Then the other hip flexor muscle that we want to work on is iliacus. So this one's underneath this hip bone here that we have, our iliac crest. It's kind of on the other side. So I'm going to use the handle of the kettlebell to kind of get in underneath there. So I'll show you on the left again, just so you can kind of see a little better what's going on. I'm going to put this at an angle, and then I want to match that angle to the top of my pelvis right there. And as soon as I get in there, it's pretty ugly. And I want to kind of point that kettlebell deep and a little inferior into my iliacus muscle. Woo! Man, that is no joke. Breathing in, contract. Breathe out, relax. You can also breathe in and squeeze my butt or tilt my pelvis. Breathe in, extend my knee. So You do all that stuff. You don't have to do all of that every single time you do a recovery session, but you know, you can break it up. If you're doing a day where you do a day after you did a run, your calves are sore, you take that foam roller, work them out. You can take the lacrosse ball. If you're not as acute sore, you're able to get in there a little deeper, find some really ugly spots and work on those. Last thing I'm going to show you is how to use this thing, which is called a voodoo band. So Kelly Starrett is a physical therapist from San Francisco. He kind of came up with this, and it can be just an awesome tool for soft tissue restrictions and just general soreness. So if you have a day where your calves are super sore, you can do this voodoo floss technique. I'll show you how to do it in a second. And move around a little bit. 2 minutes, you find immediate, huge change in soreness. It's kind of crazy. It almost seems like magic. That's why it's called the voodoo floss. So I'm going to show you what I do, a little bit of kind of combo plantar and lower calf flossing that I do sometimes before and then definitely the evening after I do a run. So I'm going to start just under my metatarsal heads, my bottom of my feet hopefully aren't too dirty. I'm going to wrap really tight and about half as tight as I possibly could, 50% tension, 50% overlap on that band. And I'm just going to wrap, come get all of that plantar fascia and those plantar muscles in there, and then I'm going to come around and wrap just above the calcaneus, make sure, hopefully you can see that, get all of my Achilles in there. And then I'm just going to keep going until I run out of band. And again, going for about 50% tension, 50% overlap. Coming up here, you can buy this thing on roadfitness.com. You can also buy knockoffs. They're all over the internet. So I have no brand loyalty. Get whatever works for you. You can also cut an inner tube in half from a bicycle. But that's how I finish it off. I just kind of wrap it underneath like that. And then I'm going to do a few movements here. So I'm going to get my soleus, kind of deflect, just getting into this deep end range, dorsiflexion in closed chain with the knee bent. So that one, I'm just rocking back and forth, feeling this kind of deep, my lower calf muscles, some of those even deeper structures like posterior tib are getting cranked on with this one, and that's nice. Then I'm going to work on my plantar fascia a little bit, the wind loss mechanism. So I'm going to keep my ankle plantar flexed, and I'm just going to add that great toe flexion to really put stress on the plantar fascia. I'm just going back and forth here. And then I'll kind of show you I can come up into sort of like a downward dog type position to get some of the gastroc, that knee straight dorsiflexion, just flossing and moving the whole time this thing is on. And then the last thing I want to get is plantar flexion, free up some of the tibialis anterior. So I'm just going to sit on my heels and just lift up. So I'm coming into almost end range, maybe even a little bit past end range of plantar flexion for me. Just small movements. I can do that. And about 2 minutes is plenty. You can probably see my toes are starting to turn white because I'm restricting the blood flow with all that compression, so we don't want to do it too long. So I'm going to unwrap it. And then what I'll find is, now I didn't do a pre-test, but already my right, you can see I've got more plantar flexion on that side. I've got more dorsiflexion on that side just from doing that little bit. Now I've been working on this too with all the other stuff, so that's not scientific, but that does make a big difference. You can see now it's all red and warm, and we kind of squeeze all the extracellular fluid and lymph and blood out of there, and then you get this nice rush of blood back in. So it's a nice little recovery tool, kind of gets the garbage out and groceries in. So check that out if you don't have one. It can be a really cool mobility tool. So that's what I do for running recovery work. And I just want to emphasize again, this is a really important part of the overall running practice. Because if you're going to go out there and ride the horse hard, you can't put it away wet. You got to brush it. You got to get it nice and dry. You got to give it some hay, a little salt lick, maybe an apple. and take care of that thing. And that's the same thing's true of your muscles and your connective tissue in your legs. So take care of yourself when you're running and do this stuff, and you will feel good and you will not get hurt, hopefully, as you increase your mileage and build up your tolerance to running the way that I have taught you.